CPR is one of the most important skills you can learn how to do because you never know when you're going to need to use it. Knowing how to properly do CPR on an adult can not only improve the effectiveness of the CPR, but also possibly give you a better outcome. For those of you who may not know, I'm a CNA or Certified Nursing Assistant, and I'm also currently training to become an EMT or Emergency Medical Technician. For both of these certifications, you need to know how to do CPR and do it correctly. So most of the information I'm going to give to you today are from my classes. While many of you may already know CPR, it never hurts to have a refresher because the medical field is always changing and evolving. My goal is to not only teach you the correct way to do CPR, but also improve your confidence while doing it. Today I'm going to demonstrate the proper way to assess the situation, follow proper procedures, and also give you some cool information about why CPR is so important. So one of the first things they teach you in EMT class is the scene safe? Is something around you going to hurt you when you're trying to help a person? Because if it will, you don't want to enter. You always want to make sure yourself is safe before you help someone else. The next thing you need to look for is, does the person actually need CPR? And you may be thinking this is really easy to tell, but it's actually a little bit more complex than that. So one of the first things you want to do after making sure the scene is safe is you're going to go up to the person and rub the chest or the arm and say, hey, are you okay? And if they answer, they don't need CPR in any way, like moving, groaning, they don't need CPR. But if they're unconscious, however, you need to then check their carotid pulse. And the way you check a carotid pulse, your carotid artery is along your neck, in between the muscle and your trachea. So you take 2 fingers and not your thumb, and you go along the side of their neck and feel for their pulse. Now we can all feel our pulse right now because we're all obviously alive. However, if you can't feel that, then they need CPR. You also want to make sure you watch for breathing at the same time, and this should take no longer than 10 seconds. If there are bystanders around, you may want to ask them to go get an AED. An AED is an automatic external defibrillator, and it basically just jump-starts the heart if they have a non-viable rhythm. CPR can be very intimidating, but knowing how to do it the correct way can help ease some of that fear. You want to make sure your patient is on a hard, flat surface, so for example, a bed will not work. You also want to make sure your patient is bare-chested, but today we're just going to pretend. So one of the first things you want to do is make sure your hand placement is correct. So you're going to put the palm of your hand on their chest, right in the middle, in the nipple line and above the xiphoid process. Now your xiphoid process is this little tip right here on the end of your sternum. And the reason you don't want to hit that is because it can actually break off and injure the tissue underneath, and that can damage the heart, and you don't want that. You're also going to want to keep your arms straight and interlace your fingers like this. You're going to want to compress about 2 inches and let the chest fully recoil before you start another compression to make sure that your compressions are effective. You want to use lots of force when you do this. And you're going to want to do 30 compressions and 2 rescue breaths using a mask. However, I only recommend using breathing techniques if you've been properly trained to do so. You're going to do 5 sets of 30 and then reassess your patient by taking their pulse again and watching their breathing. You should only stop CPR when the scene is not safe anymore, so if something else happens, you need to leave. If your patient recovers and no longer needs CPR, when help arrives, such as EMS, or you're physically exhausted and cannot do it any longer. So going back to the AED, if any time in the process an AED arrives, you want to stop CPR immediately and turn on the AED and follow the instructions. And you may have seen these around public places such as the school. They're really user-friendly. All you have to do is open it up, turn it on, and it'll start talking to you and tell you exactly what to do, where to place the pads and everything. It's really user-friendly. So now I'm going to talk about the importance of CPR. You can not only help strangers, but you can also help your family members, which is really cool. According to Singapore Heart Foundation, 70 to 80% of cardiac arrests occur in the public place or in the home. And most of the bystanders are not medically trained at all. They have little to no medical knowledge. So by you knowing CPR, you can not only help them out, but also possibly help your family members out if they have a problem. And the best part is you can save someone's life, and that's pretty cool. Hopefully you never have to do CPR on a person, but if you do, I hope you remember the correct way to do it, following the 3 steps, assessing the situation, following proper procedures, and I hope you remember why it's important. Thank you.